Dr. Nazari, let's talk implants. And there has been lately a lots of advertising out there on the radio and with people who say, dentists who say, they do instant or one-day implants. You walk in the morning, you walk in out in the afternoon, a couple, 2-3 hours later, whatever it might be, with a full implant in it. Yet, many dentists, still they put implants in it. Basically, they put the metal rod into the bone, let it sit there a month, 2, 3, 5 months, whatever it might be, and then put the crown or the cap on it. Why would anybody wait 4 or 5 months if you can do it in one shot? Can you explain that? Is it the two different procedures? Is there a reason why one can sometimes do that or not? Anyway, tell us, please.
It all depends to the site of the bone that the patient is receiving the implant. If the patient has enough bone and it's a quality bone, you can do it within the same day. You can place the implant and get a crown on the tooth. But if the patient does not have enough good quality bone or enough bone, then you cannot do the same day implant on those cases. It all depends to the case that the dentist is treating.
I see. So basically, it's a matter of making sure that there is enough substance there that this can be done, and the individual dentist will make that decision, I suppose, right? So it's not something you order like in a sandwich store where you say mayonnaise or no mayonnaise. It doesn't go quite that way, right?
Yeah, it's not like that. It's not like that. If a patient loses this tooth the same day and receives the implant, those are the ideal cases that they can get the same day implant on those cases. Again, if they have good quality bone in that site that they're losing the tooth. If you don't have enough bone, then same day implants do not work for those patients.
Well, let me ask you. So let's assume a person needs to wait 2, 3, 6 months, whatever the dentist might decide based on his condition. During that time, he doesn't have just a metal stick sticking out. I mean, you are putting some temporaries on it which don't look too bad in the first place. Am I right there?
Yes, you do get a provisional prosthesis or temporary teeth placed in those sites, so the patient doesn't have to walk around with needle sticking to their mouth.
And he can do some light chewing work on it or so, right?
You can have some light function, light chewing, as you mentioned, and also cosmetically it would be acceptable to them.
Okay. So, all right, good. Well, all right. So that explains the difference between the one-day implants. So they are there. They are valuable in some cases, doable, but not necessarily in all cases.
Yes.
Okay. Thanks a lot, Dr. Nazari. Helpful information like always.
Thank you very much.